Live from Esteem, Penn State Health Cosmetic Associates in Harrisburg, you're watching Ask Us Anything About Dermal Fillers. Now, we called it Dermal Fillers on our Facebook page, but that's not really a very all-inclusive term. So from here on out, we're just going to be calling them fillers. My name is Barbara Schindau. So as we age, the skin, muscles, and fat in our faces can kind of change and show signs of aging, and fillers are a way to help decrease those signs. I'm joined today by a facial plastic surgeon, Dr. Jessyka Lighthall. Thanks so much for joining us.
You're very welcome.
She is here to talk to us about fillers. What can they do? Who should get them? As well as physically show us how they work by administering some fillers live on a patient we have with us named Anna. So we welcome your questions for Dr. Lighthall, whether you're watching this here live on Facebook or if you're watching on playback. Just post your question in the comment section and we'll get an answer for you about fillers. So Dr. Lighthall, let's start with kind of the basic.
Sure.
What is a filler?
So fillers, kind of a generic term. It talks about multiple different chemicals that we use, that we inject in the face or hands and other areas to add volume. And I think that's one important thing that a lot of people don't realize is fillers are very different from some of the toxins that we use to quit wrinkles from occurring, like in the forehead or the scowl lines or around the eyes. Very different, and they're often misconceived and not understood. So fillers, we add volume to many different areas. So common areas that we do is in these folds here. Mm-hmm. They start getting deeper with age as all the volume starts coming down. We can fill up the grooves. It doesn't make them go away, but it can efface them and make it look a little softer. We also add volume to the lips and foreheads, the temple areas, under the eyes, and in the mid-faces, depending on what the needs are.
Okay, so who would be a good candidate for a filler, or who might want to think about getting a fillers?
So as we age, as you mentioned, we lose a lot of volume, both soft tissue volume, so fat, muscle, and things shrink and also move down a little bit, as we all know, but also in the bone. So everyone needs something different. If you're considering whether or not you're a good candidate for a filler, I'd say talk to a physician who has good training and knows about this, and we can come up with a customized plan for you. I hear a lot of people come in saying, I want X filler here because my friend had it. And then you look at the friend and you look at them and they are worlds apart. They need completely different things. So it's not a one size fits all.
Mm-hmm. So tell us a little bit about what fillers aren't. What can't they do? I know you were telling me before we started here that sometimes people confuse them with other procedures.
Yeah, so filler is not going to change the quality of the skin on the outside. So if you have some damage, fine lines, texture wrinkles, they don't do as much for that. Some of the fine lines we can fill in, but really they're not the same as doing a good skincare regimen, sun protection, lasers, peels, things like that. They're also not going to stop the wrinkles that you have when you're moving your face. So people say, oh, I look angry, I have all these wrinkles in my forehead or between my eyebrows or around my eyes when I smile, my squint lines, my crow's feet. I don't like those. Fillers won't treat that movement. Those we need to weaken with other types of treatments.
Okay. And so you are going to not just tell us about fillers, but also show us how the procedure works.
That's
so we're going to, if you want to, I don't know if you want to put your gloves on or get ready, or kind of explain to us how it works.
I'm going to step away for 1 minute
Sure.
and put my gloves on, and then we'll talk while we work.
Okay, sounds good. So while she is putting her gloves on, again, just to kind of remind you, you are watching Ask Us Anything About fillers here at Esteem, Penn State Health Cosmetic Associates, which is located in Harrisburg. They do fillers and a lot of other procedures here. So we will put a link to the Esteem website in the comment field here below this post, so that if you are interested in any of these things, you can find some more information on that. So, Dr. Lighthall, it looks like you may be ready to start here. And I also just want to point out we have Dr. Vijay Patel, who is a resident here, who will be kind of in the background assisting with the procedure. So, if you want to start and tell us,
Wonderful.
how this works, what you're going to do.
All right. So this is Anna. Hello. Anna we've known for a while, and we've talked several times about some of her concerns. For her, she's very slim and fit and trim, which is great. But the problem is when you lose a lot of volume in the face, it can create a little hollow look or a skeletonized look, and it just doesn't look like you did when you were 20. So our goal is to try to enhance that. You're not going to take you back to when you were 20, but we're going to try to rejuvenate without making you look like you had a lot of work done or unnatural. I think one thing that people are really afraid of with fillers is that they don't want to look like XYZ actress on TV who has, lips the size of Canada. They want to look refreshed but natural.
Yes.
And so specifically for Anna, she's very trim, but you can kind of see the outline of the bone. She's getting some lines in many different areas that are deeper. So these are not lines when she's moving her face. They're just there when she's at rest. These are ideal for fillers. And so for her, we're going to inject a little bit in her cheeks to try to just bring this out a little bit. And that will help the appearance of her eyes as well as in the mid-face. And then once we do that, we're going to inject a little bit into these lines here that bother her and maybe a little bit into the deep groove here. And then we'll end with just a little bit of enhancement to the lips. For her, she's got great volume in the lower lips and good shape. We're going to enhance the groove and the line that creates a more youthful appearance for her, which is mild. And then we're going to put a little bit of volume right in the middle where she's lost volume. We're not going to overdo it. Okay? We've already cleaned her face and sterilized it, and she's already had some topical numbing cream that we've cleaned off. Okay?
All right. So while you are doing this, so you'll do the filler now. Will it effect take place immediately, or can they expect to see something immediate?
Yeah, the beautiful thing about fillers is you'll be able to see the results immediately while we're doing it. So we can do one side in the cheek, and then you can compare both, and we'll go back and forth. And a lot of people are asymmetric in the face, so one side is flatter than the other. And so we may not do things perfectly symmetrical. And you're not going to take them all the way away, but you'll get to be able to see an idea of what fillers look like. You ready, Anna? Mm-hmm. Okay. The other thing I want to note with fillers is for each area that we inject, there's multiple types of fillers that we could use. So really important to talk to providers who have experience with multiple types of fillers and can customize the regimen for you.
Now, as you are getting the procedure done, is there any thing that the patient needs to be aware of? Any type of side effects or anything they should expect when they leave here and go home?
Yeah, the first thing I want to say is if you can avoid taking any blood thinners, so that includes aspirin, ibuprofen, Aleve, all of those types of medications, they will thin the blood and make the risk of bruising higher. So if you can avoid those for a week prior to having injections, you will notice that you get a little bit of a better result and you're less chance of bruising.
That's interesting. I can already tell that it looks a little bit fuller on the left side of, oh no, that's the right side. Because I'm looking the other way, on the right side of Anna's face here. And it looks like it seems like it's probably a normal procedure to have a little bit of blood during the filling.
Yep, that's very, very common. This is a normal amount. She's not getting any obvious bruising. And then the thing you'll notice once we start doing fillers, you'll see a result, and then what you'll notice is she'll start to swell up in some of the areas. So it is common to have a little bit of swelling after fillers, particularly in fillers under the eyes or around the lips. So if you're doing that, don't do fillers, we say, within a few weeks of a really important event. So don't come in the week before you're getting married for a filler. There's a high chance you may still have a little bit of bruising or swelling.
And about how long would any bruising or swelling last for somebody who's getting filler?
It's pretty individualized. Some people it only last a few days. Other people, if they get some bruising, it can linger for about a week. And again, if you can minimize the chance of getting bruising from not taking blood thinners, that will be very helpful for you.
And one thing I think that it would be important to ask for anybody watching this or anybody interested to know about is if you are interested in getting filler or any cosmetic procedure, how can you be sure that you are working with a good qualified cosmetic doctor?
That's a great question. These days, medical spas are very popular, and not that they don't do a lovely job, but sometimes when you go to various spas, you don't know who's injecting you. So it may be a nurse injector who's never actually had training in aesthetics. So it's really important to say, what is your training and what is your experience with this type of filler? We're going to come right down in here. Okay, Anna? Mm-hmm. You doing okay?
Yeah.
Great. This is her first time getting injections, and she's doing lovely. So very brave for her first time coming in and doing this. And, oftentimes you'll find somebody who, for instance, says, oh, we do fillers, but maybe they're a dentist or a family practice doctor who has no formal training in it, but have started to do it. And I think that's an important thing to ask about. What is your training? What is your certification? And then what is your experience? Other people have experience with only one type of filler and they won't vary from that at all, which is really not great because, as we talked about, not everybody needs the exact same treatment. But you can see as I'm doing this, she's getting a little bit more volume in here. And the particular filler that I put in here will continue to pull a little bit of water in, so she may see even some improved enhancement there for about 4 weeks. Mm-hmm. And you can see just the flattening of the fold compared to the other side from where we started. Mm-hmm.
Yeah, I'm not sure how good the view is on Facebook, but I can see here that it already looks a little bit fuller on Anna's face here on the right side. Again, you are watching Ask Us Anything About Filler. We are at Esteem, Penn State Health Cosmetic Associates in Harrisburg with Dr. Jessyka Lighthall, who's a facial plastic surgeon. We welcome your questions for Dr. Lighthall, whether you're watching now live. Feel free to type your question in the comment field below this post. Or if you're watching on playback and you still have a question, we can get an answer for you. So go ahead and put your question in the comment post, and we will get an answer from Dr. Lighthall about fillers, or she may be able to help with some other. She's the medical director here at Esteem. So if there's other questions about other cosmetic procedures you're interested in, feel free to drop them in this post, or again, we'll make sure that we have the website in one of the comment fields here.
Okay, so you can just see with one side, we've just enhance the result a little bit, added a little bit more filler. For her, we could probably add even a bit more in this area, but as it's her first time, you don't want to go overboard at first. You can always add more filler if you need to. If you don't like the result, you can always reverse it. We do have agents that reverse most of the fillers that we use these days, but if you don't have to do that, most people don't need that. They just get a nice enhanced result and they're happy. They feel a little bit rejuvenated. How are you doing?
Fine.
Good.
Yeah. So what is for a person who is getting any filler, what is the aftercare like? What do they have to do when they get home? Is there any certain things that they need to be doing or changing there? Sure, absolutely.
We'll chat about that a little bit more.
Should I go over there?
So I think the most important thing is when you get filler put in, you want to make sure you may notice a little bit of lumps or irregularities at first. Leave those alone. Mm-hmm. It's very common to have those initially. But they will smooth out.
So don't be alarmed if you go home and it looks not perfectly smooth.
Correct. And people may swell up more on one side or the other, so just you have to be patient and let it do its thing. If you go 2 or 3 weeks and you still have irregularities or lumps, then I would let your provider know. Having prolonged nodules or lumps or in reactions to the filler are extremely uncommon, but they can happen. But oftentimes we just need to touch up and make things a little bit more even, especially if you have a pretty asymmetric face. Now hers is pretty symmetric, so we're going to do things very similar on this side to the contralateral side.
And so when Anna goes home, or when anybody else who gets fillers goes home, are they able to kind of resume normal operations, like washing your face normally, wearing makeup if you wear makeup, and wearing sunscreen, or is there any type of things that people need to be aware of or taking precautions?
Nope. Just go back to your normal activities. Just don't push too hard on your face. Don't massage. Again, the areas where we've injected heavily, try not to play with them too much. Other than that, go back to your normal activities.
Okay. And are there any side effects or something that somebody should be looking for afterwards that may be, call your doctor and go back?
Yeah, they're very, very uncommon, extremely rare. But if you get an injection of filler close to a blood vessel or around a blood vessel, you can actually decrease some blood supply to the area and potentially have poor outcomes. If you notice extreme pain at the injection site, that's not normal. If you're noticing a lot of the skin is changing colors, it's turning white or white with little purple lines through it, that's a reason to call your provider urgently, not tomorrow, or be seen immediately. That would be the one thing to look out for. Again, that's extremely uncommon. I have personally never seen that, and I do a lot of fillers, but that is a good thing to look out for.
Okay. And is it typical, can the patient expect there to be a little bit of pain during or after getting filler?
Yeah, during filler, as you can notice, she's closing her eyes, trying to breathe, relax. A lot of these have anesthetic in them, and we put topical occasionally for people who are extremely sensitive. We'll do nerve blocks. Most people do not require that. The most sensitive place is in the lips. Usually after that, once the anesthetic wears off, there's no pain. It's just during the initial injection point. And she's actually doing really wonderful.
Yes, Anna, you are doing a great job. You feeling okay? I guess I could ask. Yeah.
I'm feeling fine. It's really minimal to no pain.
Oh, good. So Anna's reporting now, getting her filler live on Facebook, that she is having minimal to no pain. And Dr. Lighthall's been telling us kind of what to expect and what to expect after you leave and go home. And it looks like we do have a question here. So we have a question from Facebook, which is, how long do the results last for most fillers? Like, will they last for a very long time, or do you typically need to get follow-up procedures?
So fillers, the majority of fillers that we use are temporary. They're safer, they have fewer side effects, but that means they will wear off. And when they wear off depends on the location that we inject them and the type of filler used. One question people always ask, well, why can't you put a filler that lasts 12 to 18 months in my lips? Well, it's because of the type of filler. If you put that in your lips, you may have a lot of issues with swelling, and nodules or periodic swelling that comes in, and it can pull water into it, and so it just may lead to an unnatural appearance. So we put different filler types at different locations and at different depths. So the one that I just put in was really close to the bone, okay? When we get to the lips, we're very close to the surface. I cannot use the same filler. So around her mouth and in this area, most fillers will last about 6 months. In this area, it may last 12 to 18 months.
Okay. You are watching Ask Us Anything About Fillers with Dr. Jessyka Lighthall at Esteem Penn State Health Cosmetic Associates in Harrisburg. Dr. Lighthall is doing a live procedure right now on a patient, Anna, who's getting some fillers in her face. Is there anything, Dr. Lighthall, that I have not asked about fillers in the procedure that you think it's important for viewers to know?
I think it's important to just talk to a provider about your concerns. You may not know exactly what you need or you want, but just keep an open mind, go to a trained provider and say, hey, you know, these are the areas that are kind of bothering me, or I just feel like don't look like myself. You can even bring pictures of your old self when you're younger if you want. Our goal is to try to enhance what you have, and I think that's very, very helpful.
Okay, and you've been watching Ask Us Anything About Fillers with Dr. Jessyka Lighthall, and if you still have questions after this broadcast, you feel free to put them in the comment field below this post, and we will still get an answer. Dr. Lighthall, we'll let you finish up here with Anna, but thank you so much for joining us today.
So are we...
Hold on. We're good.